This is Deepu Gowda. I want to thank you all for volunteering to be one of the student leaders for the on-call case. If you are new to teaching one of the on-call cases, welcome. We're really happy to have you as part of the teaching team. If you've taught before, welcome back. We're so thankful for having you return and work with the medical students. These guys are second year students. They're going to be transitioning to the MCY very shortly. And so these last few opportunities to work with the fourth year students is really special for them to be able to learn in a kind of a low pressure environment, be able to ask questions can be theoretical and can be very practical just about the transition. So we're not going to be able to do a live orientation with you all the day of the session. So instead, I'm just recording this orientation for you all just so we can be all on the same page about the case, and particularly for the folks who've never taught it before, just to introduce you to the format. And I think this will be useful for everyone who's teaching the course as well. So this is an on-call case. If you guys remember, the on-call cases are really meant for helping the students develop hypothesis-based history and physical exam skills. So they're there to teach clinical reasoning. They're also there, to think about other, types of skills and knowledge that we need in working up patients and taking care of them when we transition to the MCY. So we kind of embed other uh, other learning objectives into these cases. So what I'll do here is kind of introduce you to the case, think about the goals for the case, and then kind of walk you through, how the on-call case typically works. So as you see, this is a case of Miss Camila Rodriguez. And the goals of this session are, as I mentioned, do a focused and hypothesis-based history and physical, kind of exploring the cognitive dimensions of that with the students. We're also going to be going over, specifically in this case, it's a case of acute abdominal pain, and this is a female patient, so I think that's particularly important here because their often exposure to women's health is not as good as it can be in the pre-clerkship curriculum. So we're trying to augment that a little bit in this case and say, what are some special considerations you would have for a woman with abdominal pain? We're also going to go over how to pre-round with the medical students. And we're also going to go over how to deliver a follow-up presentation and write a follow-up note in the chart. They have done that in the previous on-call case, but it's really worth revisiting and reinforcing. And we're also going to go over some basics on how to call a consult, since medical students are sometimes asked to do that. So let's just kind of go over what materials you have here. One is you've been given the slide deck that Sion should have sent to you. So the slide deck is for you to review. You also were sent a Word document, and I'll send you the correct document. I think the one that went out was not the correct one. Your patient is a woman. The previous case was written as a man, but I wanted to change that so we can really think about women's health in a direct way. So this is what your case details look like that you're going to read through. All right, so those are basically the two bits of material that you'll have. So Sion will email you a list of the rooms that you all are assigned to. And so this session starts at 2 o'clock with the medical students, and each of you will have anywhere from a dozen to maybe 18 students in your room, and depending on how many on-call case student leaders we have. And basically what I would say is try to get to the room a little bit early. Get there, 1:45, something like that, 1:40, and just get the room set up in a way that makes sense for you. It can be set up as a circle. It can also be set up as just, sorry, that's just a message from my sister. So it can be set up as a circle. It can also be set up in rows, facing forward. So let me go over how this session works. So you're going to welcome the students in the room. I would have a dry erase marker ready to be able to write on the board or on the wall, depending on what room you're in, to keep a differential on the board. So basically, you're going to throw this slide up and welcome people into the room. You're going to briefly go over the goals. And then what you're going to do is you're going to bring this slide up and say, look, you're in MCY, you're on medicine. You're admitting on a Saturday, and the intern asks you to go see Miss Camila Rodriguez. And basically the rest of it is, at this point, you're going to give them a little one-liner, and then you're going to say, before you enter the room, each individual student spend a minute or two writing down all the things that could be causing abdominal pain in this patient. We know very little about this patient right now, but it's great even initially for the students to just have a real broad differential diagnosis, to just kind of see all the things that could be going on. A couple minutes in silence, and then you're going to open it up and you say, hey, what'd you guys come up with? And then go ahead and write those things on the board to really legitimize the things that they're thinking about. And you might want to ask students to see if they're grouping these conditions into systems. That's really useful thinking. And so go ahead and start grouping them into systems. So basically, you're going to do a big brainstorm in the room. You're going to think about all the diagnoses and all the systems that are represented. And then you're going to switch to the next slide and say, okay, let's take a history. And this slide's going to go up. It's going to ask the students to use a bold cards framework, but also ask specific questions to explore the diagnosis. Right? So at that point, I encourage you to step into the role of the patient. So at this point, you've already read this whole case. You know what's going on with this patient. You know a little bit about her background, her family, all these different things, her symptoms. And so what you can do at this point is say, I'm going to play the role of the patient. Ask me questions. Give yourself 10, 15 minutes to do so. And students then will raise their hand or just throw out questions, and you can answer in the voice of the patient. It's also useful in these situations to have meta conversations sometimes and ask the student, why did you ask that question? You asked about, NSAID use. What were you going for there? Why'd you ask that? So it's useful actually to come in and out of the role. What I would do then is either after the history or at some point, midpoint in the history, get to this slide and basically just talk about, okay, why does it matter that this is a woman presenting with abdominal pain? What specific conditions might you be worried about in a woman coming with abdominal pain? And then ask them, well, what difference does it make that this woman is 74 years old? What if she were 25 years old? How would that make a difference in your differential diagnosis? Look, this does not have to be comprehensive. You don't have to, don't stress out if you're not a, OBGYN expert. The main point here is for the students to recognize there are specific conditions, specific histories, specific symptoms that we have to ask about and think about in women coming in with abdominal pain, and age matters. So don't stress about being comprehensive, but do a little reading ahead of time to help guide this discussion. I think this will be really useful to the students, especially since I think that this is a gap in our curriculum right now. And what you want to do here, after you've done all the history taking, is to say, okay, we're done with the history now. Let's pause for a minute. Why don't you individually, reorganize your differential? We put up a bunch of possible diagnoses on the board here. Now, individually, I would like each of you to kind of prioritize this list. Tell me what you think is most likely. And also Tell me why you think it's less like, why you think certain things are less likely. What are you going to eliminate? And what history supports the diagnoses that are high on your list right now? And then after you give them some individual time, open it up for the whole group and just go around, hear what people have to say. At this point, what you want to do is transition to the physical exam. And what you're going to do is say, hey, look, based on the information that you have right now, let's talk about the physical. What maneuvers do you want to do? And tell me why. And be specific. Don't just say, examine the abdomen. Ask them to say what maneuvers are you doing, and also get them to tell you why they're doing specific maneuvers. So let me just put the animations on. This is going to come up first. What do you want to know about the overall stability of the patient? They're going to say vitals, and then stop here and say, hey, what do you think about these vitals? Right? We see the patient's maybe relatively hypotensive and heart rate 110. We say relatively hypotensive because the patient comes in with a diagnosis of hypertension. And she's on, so that's going to be important there. And then now let's get that physical and ask them to go one by one, and you tell them what you found on the physical. After the physical is over, tell them again to reorganize their differential diagnosis. And then bring it up to the whole group again and say, what is your differential now? Let's hear your thoughts on this. And also think about what else might you want to do at this point. What other studies might you want to do given your differential after the history and physical? And after you've kind of identified what they want to obtain, go to this slide that shows some of the initial labs. And that red text is going to be up. What else do you want to know? Just leave it up there and say, hey, these are the labs you have. Anything else you want to know at this point, about these specific labs? And hopefully someone in the room is going to say, hey, I want to know the baseline values, because there's some abnormal values there with the, the hemoglobin, for instance, and the MCV. So let's see if there's baselines. So it's just a foundational concept that students often forget. So let's just really drill it into the practice of the students to make sure to always check for baseline values when you see abnormals. And then say, what can you learn from these labs, and talk about that for a while. And then you're just going to report these EKGs. I'm not going to put the actual tracings up there because it's not worth really going into right now. That's not the focus of this case. But I've got the reports up and say, well, what do you notice about the way these are presented here? Are there anything that you see that's good practice in the way these are reported? And hopefully a couple people will bring up the fact that, again, a baseline was reported. And, several EKGs were reported, EKG 1 and 2. So it's always good to look for evolution of the EKG and just mention to the patient or the students that, sometimes inferior MIs can present as abdominal discomfort. It can present as nausea. And so that's on the differential. And so seeing a EKG that hasn't evolved is very useful for us. And then what we're going to do is, again, after these labs have been obtained, let's think about the differential again. So this is really iterative in terms of refining the differential at every stage. And go around and hear what people have to say. See if there's any consults people want to call. Okay. And now the case evolves a little bit. So patient's admitted. So we think that, because you've told them in your history that the patient has not history, but the physical, that there's tenderness in the epigastrum. Also, you should have reported if the students asked that the patient's GUAC positive. And so we're worried that there might be a GI bleed, that hemoglobin's dropped, epigastric discomfort. Let's say the patient, is getting ready to go to an EGD on Monday. It's a weekend right now. You present on a Sunday, patients on PPI, on fluids, hemodynamically stable. So looking pretty good right now, getting ready to get an EGD and on the appropriate treatment. On Monday, you pre-round on your patient. So this slide is to get students to think about, if they're managing this patient, what information would they want to obtain on with the patient when they pre-round? So let them talk about it first. Just open up the question and say, what do you want to obtain? And then after you hear from them, then you start telling them, well, what does your pre-rounding routine look like? Who do you talk to? What information do you get from the EHR? And what specifically for this patient would you want to ask about? What would you want to do on the physical exam? Also give other practical details like, hey, if you're at Milstein Medicine, what time do you get there to pre-round? How much time do you allot for kind of talking to, examining, and kind of getting data for each patient? And what time does round start? All that kind of practical information can be really useful to students that are just a little over a month and a half away from being on MCY. And after they've given you all that information, you say, hey, look, this is the information that we have from bedside rounds. This is what we did. This is the labs that came in from the morning. And of course, sometimes those labs aren't available by rounds, but let's just say that they're available from that morning. And so go ahead and show this to them. And then what we're going to do here is to say, hey, these are the same, over here on the left side, these are the same data that you got on the previous slide. And let's say, now let's think about, given the information that you've just obtained, let's talk about how to organize a presentation. Okay, and so you're going to go through these kind of elements to a presentation. The key is they already know the patient's already been admitted. So this is a follow-up presentation. So the key is here, brief one-sentence summary, not really long. Subjective, tell them the kind of things that you want to present on that morning. Overnight events, what does the patient complain about? Were there any consult notes that you need to tell them about? And then objective data. And here for the physical, tell them you don't have to present every single part of the body. You can be focused, but also be thorough. Thorough yet focused is the key. And then if there's any pertinent labs, and give them some tips, like don't just blankly present the hemoglobin. Actually say, look, the hemoglobin is 9 this morning. It was down from 9.8 on admission. That type of kind of contextualization makes the presentation so much more effective. So go ahead and give them that tip. Assessment and plan. In summary, please tell them that the summary statement need not be excessive, need not be long, because the teams typically get very impatient when the summary statement is so long. Just go ahead and give a quick summary and then talk about the patient by problem. Okay? By problem. Problem number 1, abdominal pain. And sometimes that same problem is going to be a place to discuss, the abdominal pain and the anemia. Sometimes you have to separate those because the differential may be a little bit more broad. There's no one way to do this. But either way, present this by problem. Please tell them to do that. And say, okay, now what I want you to do is take a few minutes, organize your thoughts for this particular patient, and practice doing it with each other. Give them 5 minutes to do that, and then open it up. Let's hear from 1 or 2 people to see how they would present a follow-up presentation. And then you give them this slide. Things are changing here. You drop by Miss Rodriguez's room later that morning, and she is different. She's moaning. Her exam is worse. What do you do? What H&P do you want to obtain? What actions do you want to take? And here, basically, what you're talking about is how to assess someone when they're, acutely worse, and making sure you get some data quickly, um, but go ahead and feel comfortable reaching out to the intern and resident and letting them know what's going on. Grabbing a nurse outside the room if the patient is really not looking good. Um, Alert them right away. But at the same time, go ahead and get basic information before you go out. You don't want to spend a half an hour in the room, but you don't want to just, walk in the room, see the patient's confused, and run back out. You want to see the patient's confused, lethargic, moaning, ask a few questions, do very brief, focused evaluation, and then get help. That's the bottom line. And then here's some information that you've obtained. You're going to present them this and say, what do you think's going on? You call the intern. Your intern's on the way. She's on her way. And you say, look, this is the data that we got. These are the labs. And this is the upright chest film. And obviously this is an upright film, but, let's not worry about the fact that this patient wouldn't be going down for an upright film. But just say, this is a kind of a representative chest film in this patient. What do you see? And of course, there's air under the diaphragm there, and say, what do you think that's about? Don't tell them it's air under the diaphragm. Just point it out and say, what is that? And see if anyone can kind of figure that out. And then if they can't figure it out, tell them what it is. And then say, okay, there's air under the diaphragm. What do you think's going on there? What could that indicate? And maybe someone is going to recognize that there could be a perforated viscus. And when you're still on this slide, you want to ask them, what do you want to do about this? Now that you think this could be a rupture of the stomach or, small intestine, colon, what do you want to do? Hopefully someone's going to say, well, we should get surgery involved. And at that point, show them this slide and say, look, sometimes you will be asked to call a consult. Don't be afraid about it. And here is just it takes some practice. And here's a framework that you can use to help organize your consults. This is good for you guys too. You're going to be interns very soon. And this is obviously a very common thing you're going to be doing nearly every day when you're on service, is calling consults. So here's just a nice framework to use when you're calling a consult. Right, and if you have time, of course, the time may vary from room to room, but if you have time, say, why don't you practice with one another, form pairs, practice calling a consult, and then open it up to the group and say, hey, let's hear from one or two of you. Let's pretend that I'm the surgery resident. Why don't you call me? And why don't you do a little role play there about calling the consult? Right, and this is just kind of the final thing, saying, hey, look, patient was taken to the OR for an X-lap, because of the perforated viscus, and she's doing well. We think the final diagnosis is that, this was a perforated viscus from an ulcer. Thanks so much, y'all. Have a great time. Please keep in touch. Let me know how it goes after the case. We thank you so much for your teaching. Have fun.